Well, earlier I spoke to the Health Secretary, Jeremy Hunt, and I put it to him, is it really possible to change a culture in the NHS that went all the way to the very top?
Well, it goes to the whole system. And Sir David Nicholson was one of many managers and indeed ministers who failed to spot over 50 warning signals that should have alerted people to the problems that happened in mid-staffs. I don't happen to believe that he was personally responsible for what happened, but he does share that wider responsibility. He's apologised for that.
But nonetheless, the Francis report speaks of a bullying culture. You're now encouraging a candour culture. Can the same man who was on deck during a bullying culture now preside over a candour culture?
Well, David Nicholson, when it comes to patient safety, has led the campaign against, for example, MRSA, which are now at their lowest levels since records started. He's led the campaign to reduce waiting lists, which has saved many thousands of lives. And because I don't think he was personally responsible, I think he has a very big part in introducing the changes that I've announced today.
A significant element of the National Health Service, and an increasing element, is a private provider element. And they have the question of confidentiality. They want to keep stuff quiet from their competitors. How can you get candour out of them?
Well, they will have to observe the duty of candour, and let's remember that duty of candour is part of the professional requirements for all doctors and nurses operating in the NHS. But I think to talk about this as an issue of privatisation versus public sector hospitals.
Well, I'm not. I was just talking about confidentiality and candour, which is a problem if you're a private company competing against another one. You're going to be rather inclined not to talk about things which might damage your chances.
Well, candour will, and the duty of candour will apply to all safety issues, whether or not you're a private hospital or a public hospital.
Okay, well now, one of the things Francis talks about in the report is that there should be a mandatory minimum number of nurses. There should actually be identified how many nurses are needed for whatever sector of the care system is in place. You don't go that way.
Well, we achieve the same end, but by a different route, because it's clear that in some places, managers have cut corners in some hospitals.
According to the CQC, 1 in every 10 hospitals is in this condition.
Well, when we have this new chief inspector, they will look at the whole problem. Part of it might be the nursing numbers, part of it might be the leadership of the hospital, part of it might be the clinical procedures, and that hospital will be required to put that right. So I wouldn't be at all surprised if the result of today's announcement is that a lot more nurses are hired.
But unfortunately, the biggest pressure all these places are under is cash, isn't it? I mean, let's face it, the board is trying to come in on budget, and a lot of what went by in the past was people trying to reach foundation status when they weren't fit to do so.
That's right. And all public services are under pressure at the moment. We've protected the NHS budget, and as a result of that we have 6,000 more clinical staff in the NHS than we had at the time of the election.
And 8,000 fewer nurses.
Well, actually, if you look at the overall picture, there are, including doctors and nurses and all clinically qualified staff, it's gone up, not down. But as I say, I don't want to...
How do you end up with 1 in every 10 hospitals short of nurses?
But you're asking me, or you're perhaps suggesting, which I know you wouldn't think is the right thing, even you, John, that I as a minister should tell hospitals how many nurses to hire. What I'm saying is there may well be hospitals who don't have enough nurses, and this is a system that will expose that. And as a result, in those cases, more nurses will be hired. But I think the start is absolute honesty about where you have failure and where you have success. And that's the big change from today.
Secretary of State, thank you very much for talking to us.
Thank you.